Good morning, Trinidad and Tobago. We welcome you to the most accurate and up-to-date source of information on the national COVID-19 response, and that is the Ministry of Health's COVID-19 Media Update. Today's panel of presenters is headed by the Honorable Terence Dayal Singh, our Minister of Health, followed by Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health, and Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry, and I will be the moderator for this conference. We begin with Dr. Parasram, who will present the latest clinical update.
Hi, good morning. Thank you, Mr. Alexander. Good morning to the Honourable Minister. Good morning to Dr. Hines, members of the media, members of the viewing and listening public. So the COVID-19 dashboard, if I could have that one up, please. As of the 5th of July, 2022, update number 1141. The vaccination status remains at 51%. Population, in terms of the new positive cases, 73 over the last 24 hours. Deaths reported within that period, 2. Condolences to the families of those individuals. The total patients at hospital are now at 88 patients. That includes step-down and hospital facilities. And of course, the patients by vaccination status July 22nd, 2021 to present, 80% of those hospitalized are not fully vaccinated, and again, upwards of 93% roughly in terms of our deaths have not been fully vaccinated. By way of a further breakdown of those 88 persons at the health facilities, Hoover Hospital and Multi-Training Facility, 26 persons, 2 in the ICU, 3 in the HDU, Cora Hospital, 6, Augustus Long, 28 persons, St. Anne's Hospital, 4, Arima General Hospital, 7, St. James Medical Complex, 7, Scarborough Regional Hospital, Fort King George, 8, Scarborough General Hospital at Signal Hill, 2 persons. By way of a quick monkeypox update in terms of the global status, cases reported to WHO confirmed to date 6,000, just upwards of 6,000, 58 countries now affected, some new African countries beyond the normally endemic areas are affected as well. WHO to reconvene the expert panel on 18th of July or prior, given the rate of spread, and to determine if a public health emergency of international concern is constituted. Thank you, Mr. Alexander.
Thank you, CMO. We now go to Dr. Hines for the epidemiological update.
Thank you, Mr. Alexander. Good morning to the Honourable Minister. Good morning to the Chief Medical Officer, Dr. Parasram. Good morning to members of the media and members of the viewing and listening public. If you can have the first slide with the epidemic or the epidemiologic curve, we'll take a look at where we are at the current time. Looking at that curve as it comes up on screen, we will note, as we've been saying, that we've been tracking and we have all the data on the graph related to the period from July 2020 over on the left-hand side in grey. All of 2020 is in grey. 2021 in the more of the solid colors, January to December, December being the red over to the right-hand side of the graph, and then the individually visible bars, and I think they should be visible on the screen, are the daily counts for the months January to June of 2022. If we look at June, we will see that in the initial part, the first couple of weeks of June, there was a fairly rapid decrease in the number of cases daily, a sharp downward trend, which leveled off to some extent in the latter half of June. So the decrease wasn't as rapid in the latter half of June, possibly related to a lot more of the mixing activities that may have been taking place at that time. But we do continue to monitor, and the overall trend is still downward, albeit a little more slowly at the end of June. If we look at the same data aggregated at the weekly time scale, we see that in the next graph, we have a very good example of that week-to-week decrease throughout the months of June, June being the blue bars. Next slide, please. June being the blue bars over on the right-hand side. Those get shorter and shorter. And if we look at actual percentage changes between the last 2 completed weeks, those would be Epi Week 26 and Epi Week 25. There was a 22% decrease in the total for Epi Week 26 compared with Epi Week 25. Epi Week 25 was in turn 18.7% lower than Epi Week 24. So we did see that week-to-week decrease throughout the month of June. And we're hoping that that trend continues. If you look at the background, the backdrop, that salmon section, we also see that there was a decreasing trend with regard to the positivity, the percentage of the tests for COVID that actually came back positive during that time. If we look at this current week, the current Epi week being Epi week 27, we're actually at 20% positivity. The week before was about 26 or 25. So we are seeing a downward trend both in numbers of cases and in percentage positivity throughout the month of June coming into the beginning of July. If we move to the next slide, that's really just the tabular version of what I just said, so we can move forward again to the slide after that, which gives us the monthly aggregates. And looking at the monthly aggregates again, we see where May was considerably higher than June, May being the gold bar over to the right-hand side, and June being the blue. Next slide, please. We're now in the month of July, which is the pink bar that has been added to the right-hand side of that graph. And we see the background again giving us that downward trend in that salmon section, that downward trend in positivity, which again is an encouraging sign. So on a monthly time scale, we saw the positivity drop from about 28 or 29% down to about 27 or 26. So we're seeing that movement downwards, which is encouraging in terms of the status of circulation and spread of disease at this point in time. If we move to the next slide, we're looking at the demographics, and those have remained largely consistent throughout the entire time frame from July 2020 to the current time, with a fairly even male-female balance, and the largest percentage of individuals being in that mobile active working age group between 20 and 49. Now, if we move to the last slide, we see that there's a different pattern with the deaths, and the deaths have a little bit of a male preponderance, about 57% men, next slide, as opposed to the females, and there is also an overrepresentation or preponderance among the older age groups, those over 60 accounting for 2/3, just about, of the total deaths. If we can show the next slide, we can see that a little better. Thank you. And among those who have passed, there are several consistent features. One is the presence of what we call comorbidities, other illnesses, diabetes, hypertension, pre-existing cancers, those things that were additional risk factors for an adverse outcome, and even more importantly in terms of our ability to intervene, the absence of vaccination is a key factor at this point. Those who passed on having been more than 93% in the unvaccinated group. So we do continue to encourage all individuals, especially those with pre-existing conditions, and especially those in the older age groups, to get your vaccine, get your booster, and at this point, those in the older age groups are eligible for a second booster, and this is worthwhile to pursue. So we would want to continue to let those individuals be aware of this so they can access that at their health facilities. So with that, I'm going to turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. I'll now hand you over to the Minister of Health, who will provide us with today's vaccination figures and an update on other COVID-19 related developments.
Thank you very much, Al. Good morning to Dr. Parasram and good morning to Dr. Hines. Our friends in the media, good morning to you, and all persons listening, welcome and good morning. So, what are our vaccination numbers? So, as of yesterday, 714,406 persons have completed their vaccination program. That's 51% of the population. Those who are boosted, 166,498. The total children 5 to 11 who took advantage of the vaccine program, 2,056. So that is, in summary, the vaccine data highlights. I want to go now to follow up on the Honorable Prime Minister's statements at the press conference at Piarco Airport last Saturday, where he indicated that the masking mandate will be lifted by the middle of this month, or 2 weeks from Saturday when he spoke. So that will take us to Saturday, the 16th of July. So all things being equal and barring any unforeseen circumstances, from Sunday the 17th of July, all things being equal, the masking mandate will be lifted. However, we are going to be doing a risk-based recommendation for various vulnerable groups and special population where we recommend that you still be masked. But before we get there, the new regulations that will come out will still have masking as a feature, a mandatory feature at healthcare facilities. So let me make that point. So you go into a hospital, a clinic, a healthcare facility, masking will be required. So let's leave that aside now and go to the recommendations, where we'll be asking persons to do their own risk-based survey of themselves, and we'll be publishing some guidelines by next week, Wednesday. So we're going to come with the details by next week, Wednesday. It will be posted on the Ministry of Health's website, but what we will do now is give you a framework as to what we are recommending. So we are looking at 4 vulnerable groups. 1, the unvaccinated, which is 49% of the population. Roughly half the population is unvaccinated. So you are going to have to take special care and make a decision as to whether you wear a mask or not, but it will be recommended. 2, the immunocompromised, especially those who have non-communicable diseases like hypertension, diabetes, the cancers, the kidney diseases, you're on dialysis, you are overweight, you are obese. We are also paying attention to the elderly, that is a special population that we are recommending that you stay masked, and we are going to be putting out the conditions and the situations where we recommend masking. And 4th, the pregnant population. So the 4 categories of persons that we are recommending that you still wear masks are the unvaccinated, because you are basically unprotected. 2, the immunocompromised. 3, the elderly, and the pregnant population. So what are some of the situations, you may ask, that we are going to be advising people to continue to wear masks? So all these vulnerable groups we have spoken about. But let's get a little more granular. And as I said, we will put out all these recommendations by next week. So geriatric homes, where we have our elderly in close proximity to each other, ventilation may or may not be optimal. So we are recommending that visitors and staff still remain masked. These are recommendations. Children's homes, again, that don't have their parents around them, we are recommending that masks still be worn. Any areas in which people are congregating, especially those areas that are indoors with inadequate ventilation, where it is difficult to practice social distancing. So, for example, public transport. If you are in a maxi taxi, a taxi, the inter-island ferry, you're going to Tobago, airplane, international travel, even though the airlines may not insist on a mask, you have to make that decision. Do I want to run the risk of getting COVID, sitting next to somebody who you don't know in a confined space with no social distancing for 4 hours, 5 hours, 6 hours? So we are recommending that masking still continue there. Let's say religious services. You may want to consider keeping on a mask, especially if you are elderly, immunocompromised, pregnant, and so on. And all indoor activities, make that decision based on your risk, whether you want to wear a mask or not. If you feel you need that extra layer of protection, physical protection, wear a mask. So the risk-based recommendations are going to be based on your vaccination status, your medical history, your age, your household. Do I live with a lot of people who are immunocompromised, the elderly? You may want to consider that. That's your choice, and look at the space that you are visiting. So this, in a nutshell, is the framework we are presenting to the country today. The details will be fleshed out. The CMO will be coming back next week, Wednesday, with the detailed grid. It will be posted on the Ministry of Health's website so people can be informed and make an informed and educated decision as to how to move and conduct their business from next week, Sunday, moving forward as to whether I wear a mask or I don't wear a mask. So we are asking the population to pay attention to their own health status. It is not too late to get vaccinated, to get that added layer of protection. Remember, half of the population is not vaccinated. And when those masks come off, the unvaccinated will be assuming a little more risk in contracting COVID. So, Al, that is where we are. So, we are now open for questions and answers. Thank you.
Thank you very much, Minister. As is the custom, we will be taking 2 questions from each media house in the first instance, and followed by an additional question once time permits. As per usual, we would ask persons to identify your name and the media house that you represent before posing your 2 questions. We start this morning with the Newsday.
Good morning, everyone on the panel. This is Paula Lindo from the Newsday. So my first 2 questions relate to masking. The first one is the regular healthcare system able to handle any potential COVID spikes once the mandatory mask wearing is removed? And second, will employers, if, for example, I decide I want to continue to wear a mask in my workplace, can my employer insist that I remove it? Thank you.
Thank you. So if we pay attention to the data we have been publishing, our hospitalization numbers are now well below, but not well below, have been hovering around 100, 120 for a while. We have now dipped below 100. Our ICU levels are very, very low. So the answer to your question is yes. And that is why we are making the decision at this time, because we feel that if we get any spike in cases, that the healthcare system has more than enough capacity at this point in time to cope with that. And that is why we did not make it before. We wanted to wait and see whether these downward trends in both number of cases, this rolling 7-day average, which Dr. Hines spoke about, the positivity rate, which has declined to about 26%, that has gone down and seems to be a feature now. Our hospital rates, our hospital numbers are down to 100. Hospital occupancy is 15%. You remember in the bad old days, we were up to, in some cases, 70, 80, 90%. So we feel that these trends are sustainable at this point in time, and that is why we did not make that decision there. On your second question, the employee-employer relationship is one that will be determined by the employer and the employee. Again, based on the risk analysis we have put out, but employers will deal with those situations on their case-by-case basis.
Thank you very much, Minister. And with that, we go to azpnews.com. We're ready for your 2 questions.
Thank you very much. Al Pryor Bihari, azpnews.com. My first question is for the Minister. Minister, in terms of the mask wearing, of the removal of the mask mandate, right? It is just recommendation. So in other words, if someone um, is unvaccinated and chooses not to wear a mask, there is no penalty involved. In other words, you have to try to do some moral suasion and let people be responsible and make a risk assessment. That is the position of the ministry. No, one. And my second question again to Minister. Minister, there seems to be a problem with the distribution of CDAP drugs. Pharmacies are saying that they are not getting certain drugs on time, and people are complaining. I don't know if you want to shed some light on that. Thank you very much.
Thank you. So prior, yes, so there's no penalty for not wearing a mask. And the issue of the CDAP drugs, as you have raised in the past, is not one of supply. It is one that we have determined, speaking to NIPDEC, of pharmacies not ordering their drugs on time and in sufficient quantities. We check on this. We have enough CDAP drugs in the country. Thank you very much, Prior.
Thank you for that clarification, Minister. Guardian Media Limited, we are ready for your questions.
Well, thank you very much. Good morning, everyone. So my first question is for Dr. Hines. Dr. Hines, you outlined a basically favorable epidemiological trajectory for us there, but taking into context that we've been seeing all these parties and then we've been loosening restrictions and that sort of thing. What does this mean for our country on that journey towards endemicity? And is it a case that we're missing cases, which is why we're seeing these low case numbers? And now my second question is for either the CMO or the Minister of Health. By chance, we had those fiery protests around the nation's capital on Monday. Do we have any reports of increased numbers of people coming into accident and emergency, probably at the Port of Spain General Hospital, for respiratory and related ailments or anything like that?
Okay, so Richard, I wouldn't have data on that as yet. The individual A&Es will be more limited to Port of Spain. They have not reported any undue increase in that. I'll hand you over to Dr. Hines.
Okay, thank you for your question, Mr. Khan. As I mentioned as we were speaking about the epidemic curve, looking at the decrease at the start of June and then the leveling out towards that latter part of June, bearing in mind and taking into consideration the additional movement, additional gatherings that would have been taking place in that time frame, clearly we're looking at that balance between enhanced interaction, relaxation of restrictions, and transmission of a respiratory transmissible virus. So as we make more moves towards relaxation and increased interaction, that will slow the rate at which the viral transmission disappears or decreases. That being said, that is a balance that will have to be struck, and the point that we are at right now, where we are observing the effects of the virus on the population, the levels of severe illness that are arising out of the current levels of transmission, we are monitoring all of that very carefully as we look at the ongoing ability of the health system to deal with what is coming out of the current viral transmission. The fact that some people may not test in the public system is not something that we consider to be data we're missing. Individuals not testing in the public system and not becoming ill enough to require care at any level are then individuals that, from a public health perspective, we aren't as worried about. If they become ill, of course, they know where to go for care. But once they aren't becoming severely ill, then this is a good sign for the population in general. And it is what we are monitoring as one of the factors in how we assess the impact of the current levels of transmission. So if we're having transmission and it's not translating into severe illness and overburdening of the system, again, this is a positive sign, and it's a sign that we're moving towards a state where our health system and our population are better able to manage levels of transmission of the current variant of the virus. Noting, of course, that that could change if the variant changes. I turn you back over to Mr. Alexander.
Just before we go back to Al, Richard, and for members of the public listening, I don't want the members of the public to go away the impression based on the question that we are lax or we are missing cases. Richard, if you recall, once we started vaccinating and once Omicron became the dominant variant, we said clearly, very clearly, that we look at all factors, but the dominant factor now is not necessarily number of cases. What we look at more closely is hospitalization rates. So that is the key determinant, because if someone is sick, they will go to a hospital. If someone is very ill, they will need an ICU bed. And that is why at the start, when I was answering Paula Lindo's question, I was at pains to point out that we are making the decision based on our hospitalization rates. Our hospitals are not seeing the number of persons who are ill or severely ill needing either primary care, secondary care, or ICU care, right? So I just want the population to understand how we make these decisions and not to be pay too much attention to this issue of missing cases.
Thank you, Minister. We go to Newsday for a follow-up question.
Good day again. My next question is to, I think, either Dr. Parasram or Dr. Hines. We've seen in some countries where the Omicron BA4 and BA5 variants are becoming more and more detected in terms of spread. And I'm wondering, are we still doing genomic testing here? And have we picked up any instances of either of those variants? Thank you.
Yeah, we still are doing genomic sequencing. The last report I would have had was on Friday. We normally get a report on a Friday. They would have had 18 samples done at that point in time. The majority of cases are of the BA2 lineage. We have picked up one BA4 in that group of testing, and there was one Delta as well. So just to underscore that we still have Delta variant of concern in circulation at some point, albeit at a very low level in Trinidad and Tobago. And of course, the predominant variant we have right now is the Omicron variant of concern, and the sublineage that is dominant seemingly is the BA2 type. And we have, of course, discovered one of the BA4. If we have discovered it in that small sample, it suggests that it would have been in circulation for a couple of weeks well in Trinidad and Tobago. So certainly we would have BA4, BA2, and as Dr. Hines has indicated, we have to keep a close eye on what is happening in terms of our total numbers, hospitalization, and all the other indicators over the coming weeks to see what happens. But generally speaking, the trend seems to be suggesting the trajectory is going in a good direction. And just to underscore what Minister said in the last question, our testing strategy has remained unchanged for the longest while in terms of months. So therefore, we will probably pick up in terms of our testing. It gives us a good idea of anybody who presents with viral illness. We do test for COVID still. So nothing has changed by way of testing strategy, and the numbers give us a fair indicator of who's presenting to our health facilities and what proportion are COVID-19.
Thank you very much, CMO. With that, we go across to azpnews.com for a follow-up question.
Good morning again, Al. My question is for Dr. Hines. Dr. Hines, about a year ago, the difference in terms of the deaths, in terms of gender, was about the same. But now there seems to be more males by far, in terms of about 58% compared to 42% of the females. What do you think is the reason for this?
Actually, Mr. Barry, I need to correct you. When we started the pandemic and monitoring the gender balance among the deaths, it was actually 75% male and about 25% female, and it very slowly over the time frame shifted to be a little more balanced. So there's actually less of a disparity at this point than there was earlier. And there were lots of queries about whether it was later health-seeking behavior among men, higher levels of untreated comorbidities, lots of things that nobody really has an answer to. But we did note that the change from really very male predominant to closer to 50-50 took place slowly over the course of the 2 years, and now we're at basically 57% men, 43% women.
Thank you so much, Dr. Hines. We now go to GML, Guardian Media Limited, for your questions.
All right, thank you very much. Minister, let's just take a look back now at the mask policy, right? I'm taking a look right now at some statistics I would have gotten from the police service for the number of tickets that would have been given out since the policy was in place. And on average, we're seeing around 1,500 or more people every month getting ticketed for failure to wear masks. But since the mandate has been dropped for people traveling with families in a vehicle, that number went from around that 1,500-ish figure to, in the last 2 months, 29 people alone being ticketed. So looking back on this policy, is there any sense that maybe it did not work in the way that it was supposed to work, being that families were targeted mainly for breaches?
I don't see how you can make that conclusion. There's a whole difference, as I keep saying at these press conferences, and that's the error that we fall into. We tend to mix up correlation with causation. The mask mandate served a very useful purpose when we had it for families in cars. It served a very useful purpose, and as we relaxed restrictions, it was a sign that our vaccination rates were going up and that the rate of positivity was coming down. So I don't share the correlation that is trying to be made.
Thank you very much. We go back to azpnews.com for a follow-up question.
Thank you again. Minister, the Pfizer vaccines for the adults, would have expired. Can you tell us how many, had to be thrown away?
Yeah, just hold on one sec, please. I think I have the information here. Yes, so as of the 2nd of July, Pfizer adult, we had received 684,000 358,000 were administered. So that's the difference there. What you will recall, we had destroyed the bulk of when we got the first tranche. And then the second tranche of 75,000, we are going to have to dump, I believe here I'm seeing, about 75 minus 27. We administered 27. So that will be the difference to be dumped. 75 minus 27. Or not dumped, sorry. Destroyed, incinerated.
Thank you very much, Minister. Guardian Media Limited, we come back to you for a follow-up question.
Minister, could you give us the current rate of vaccination for first doses, daily rate, that is, for first doses, second doses, boosters, that sort of thing?
Yeah, sure. So I have that. So we were going pretty good, Richard, until June 30th. Once June 30, until about June 30th, we were doing about 500, 600, 700 doses per day across first dose, second dose, and booster. But once June 30th reached and the Pfizer came off the system, we are now down to a total of first doses 47, a grand total of 47. And yesterday, first doses and booster, a total of 135, Richard. So that tells you how things have gone since the booster program for Pfizer ended. However, and I'm glad you asked this question, adults can still be boosted with J&J and Sinopharm, correct? Yes. So it doesn't mean because the Pfizer booster isn't available for persons 18 and over, you shouldn't be boosted. You can still be boosted with J&J and Sinopharm. So thank you for raising a very important issue. Thank you very much, Rashad.
Thank you, Minister. We go back to the Newsday for another question.
Just following up on that question that was asked, I've seen people saying they're going for, I'm thinking it's a fourth shot, but people are saying a fourth booster. Is that what status are we on in terms of re-upping vaccinations?
Yeah, so it's not a fourth booster, thank you. It's a fourth shot. So you'd have gotten your first shot, your second shot, your first booster, and then your second booster. So in total, you'll be getting your fourth shot, not a fourth booster. You'll be getting your second booster or fourth shot. Okay? Thanks.
Thank you very much for that clarification and the question. Guardian Media Limited, your question, please.
Minister, are we doing anything at all to bring those numbers up? Reworking anything? Because I mean, 47 first doses a day kind of seems practically negligible compared to what we've been doing before.
Yeah, so I really share that adjective that you have, Richard. Look, Richard, we have put out all the information. We have advised people. We have had group discussions, online discussions. We have spoken to people at clinics. At this point in time, the vaccinations are there. They are available. But 49% of the population has made up their minds. They are not going to be vaccinated, and that's the risk they are taking. There is no more information to give out. There is no new strategy that anyone can think of, because I met with PAHO, was it last week or week before? I talked to people all over the world. There is no new strategy because this is a global trend where vaccination rates have really gone down significantly. So it is at this point that we are still asking people. We are not stopping the vaccination program. It's still available. Make an informed decision. But now, with the dropping of the mask mandate, as I said, and thanks again for raising this issue, Richard, that 49% of the population, you are really placing yourselves in jeopardy by not being vaccinated. It means a vaccinated person can take a little more risk without a mask. An unvaccinated person is putting their lives in danger. So we just urge people to get vaccinated if you are not yet vaccinated.
Thank you very much, Minister. And we do at the Ministry of Health continue to urge persons to get vaccinated, and please get boosted if you're vaccinated already. With that, we go back to azpnews.com for a follow-up question.
Thank you again, Minister. I just wanted to know if you have the school figures, and also as the vacation is going to start, there'll be a lot of camps. Any advice for people who and children who may want to go to camps? Thank you.
So Minister Dolly didn't send me the school figures, but she did answer a question in Parliament yesterday about COVID in schools. So maybe we could refer to that. But there has been a general, really good decline in the number of school cases. So it doesn't seem to be an issue of concern now, especially now that schools are going to be closed or closed. And the issue of camps, I would advise any parent, if you're going to send your child to a camp, especially now as the mask mandate is going to be lifted, get your child protected. And the best form of protection, especially now without a mask, is to be vaccinated. We still have vaccines for that 5 to 11 group. Get yourself vaccinated. Okay? Thank you very much.
Thank you very much. No, we go to Newsday. Newsday, we're ready for your follow-up question.
Thank you again. So in terms of both, as prior said, the July-August vacation, and with schools going to reopen in a few months, are we seeing the vaccination levels of children who might be going out for the first time increasing to pre-COVID levels? There's a set of vaccinations that you have to get to enter the school system. Is this going back up? I know we had a shortfall over the last couple of years.
Thanks. Good question and good issue to raise. So you may recall back in February, March, I believed, I did alert the country that our vaccination levels for childhood diseases, MMR, polio, yellow fever, and the like had declined. And I did indicate at that time that through Nurse Grace Sukchan and the expanded program of immunization, we were looking for basically 2,000 children. Was it 2,000 CM? I believe it was 2,000. 2,000 children to get us back up to herd immunity. We have reached that for MMR and so on. But I did indicate, I believe last week, that the polio vaccination rate is about 1% off. We are supposed to be at 95%. At that time, we were at 94%. And we were looking for a further 200 children to bring us back up to 95%. I recall saying last week that the polio virus was found in sewage in London, which is a bit of a concern. And I did say at that time that the anti-vaccine messages being put out by a certain group of individuals had the unintended consequence of frightening parents away from vaccination in general. Because remember, a lot of laypersons, when they hear all this misinformation about COVID vaccines for children, they don't necessarily make a distinction between COVID vaccine and vaccines. And this is the feedback we are getting from around the world and through PAHO, that the anti-vaccine message, and we have it here with a group of individuals sharing their misinformation and disinformation, is having a negative impact on vaccination rates. And that's a real pity, because we don't want any child to come down with measles, mumps, rubella, yellow fever, polio. So a disservice was really done. Now we have to work extra hard to find these 200 children to vaccinate against yellow fever, not yellow fever, against polio. What we look forward to with the new school term is a return to the old tried and proven system, where to get into a primary school, you have to show evidence of your vaccination status. So we look forward to that and urge parents to ignore the noise, ignore the misinformation, ignore the disinformation being put out by persons. They don't have your best interest at heart, and we have been vaccinating children for these childhood diseases for decades and decades and decades with no issue. Unfortunately, some parents are misinterpreting the misinformation about COVID vaccine, and they are just lumping all vaccines into one. And that is unfortunate, but when we communicate in the way we communicate, these are some of the unintended consequences of that. So thank you for raising the issue.
Thank you, Minister. Guardian Media Limited, we see your hand. You ready for your question?
Thank you very much, Al. This one will be my last question here. Minister, do you have any idea at this point what the mask recommendation will be like for children in schools? Because I know that has been a big concern for parents.
Yeah.
So is that going to be a recommendation, a mandate? How do you have any idea how that's going to look?
Yeah. No, that's a very, very good issue to raise. And what we discussed this morning, we are going to be paying attention to all the data between now and school opening. But as for now, and for the next couple of months, from Sunday, 17 July, the mask mandate is off. And we will cross that bridge with schools based on the data we have then, Richard. So hopefully, once the data continues to be good, and if more and more people get vaccinated, then we will make further recommendations.
Thank you for your question, Richard. And with that, we go back to the Newsday.
Good day. This will be my final question too, I think. In June, CMO, you had said that we were looking to acquire vaccines against monkeypox through PAHO. How is that process going? Thank you.
Yeah, so we're still in talks with PAHO, as well as we had originated some talks through CDC in the first instance. So those talks continue in terms of acquisition, and of course, if as we proceed, we will alert the population as we get further information.
Thank you very much, CMO. GML, Guardian Media Limited, see you back. Okay, that was the last question. Ladies and gentlemen, thank you very much. We have come to the end of today's media conference. And as we close, we ask that you please continue to protect yourself and your loved ones. We want to remind the public that COVID-19 vaccines are still available, as well as boosters. And of course, if you haven't received your vaccine as yet, we encourage you to get yours now. Vaccines have proven to be safe, effective, free, and they're still available at multiple locations. We invite you to visit our website at www.health.gov.tt and our social media pages for accurate and up-to-date health information. Finally, as we carefully roll back the restrictions, please continue to observe the 3 W's. Be safe, and goodbye for now.
Developing a vaccine is a long road full of checkpoints. Different phases of testing are designed to make sure it is both effective and safe. But with the whole